Welcome to today's MinMD Real Talk webinar, Vacuum Erection Device Online Clinic. My name is Austin Hunt, and I'll be your moderator for this event. I work on the marketing team here at MinMD, and I'm excited to be hosting this session today. Before we get started, we have a short disclaimer that we need to review.
The health and medical information provided during this webinar, as well as the questions and responses from the webinar providers, are solely for informational purposes. This content is not intended to take the place of advice or treatment from health professionals. Nothing presented in the webinar is intended to be used for medical evaluation, diagnosis, or treatment. It is not intended to substitute for your relationships with your own healthcare and pharmaceutical providers. Always seek the advice of your healthcare provider before beginning any new treatment, or if you have questions regarding a medical condition.
All right, with that being noted, I'm pleased to introduce today's presenter, Dr. Daniel Martinez. Dr. Martinez is a fellowship-trained physician specializing in sexual medicine, andrology, and male infertility, and he's located in Miami, Florida. Today he's going to cover VED device assembly, penile reconditioning, VED use for sexual activity, penile rehabilitation for post-prostate treatment, and then hold a live Q&A to close out the webinar. So without any further ado, I'd like to kick things off by welcoming our presenter. Dr. Martinez, over to you.
Thanks a lot, Austin. Really appreciate it. First and foremost, I want to give thanks, or I want to thank three different groups of people. Number one, thank everybody out there for taking the time out tonight to talk about something very educational and entertaining, we'll say. You know, the vacuum erection device, I'm a huge fan of it. I've implemented it in my practice to most of my patients. It really is a wonderful weapon in the armamentarium of things that we use to try to battle erectile dysfunction, whether it be to help you have sex or help you maintain good penile health. So thank you everybody for taking time to be able to learn a little bit about this. I'd like to thank MinMD Austin and the MinMD people. You know, you guys have been wonderful from day one. I've probably used you guys close to 10 years now, probably since the beginning. And to me, it's amazing. You guys provide a wonderful product, wonderful customer service, and you treat my patients like they're your own patients, really. And I thank you for that. And I'd like to thank also Owen Munford for giving us this beauty right here and allowing, partaking in this, in sponsoring this event. You know, the vacuum erection device, everybody laughs about it, and it always reminds me and a lot of the patients that I see of that scene from Austin Powers where they finally take him out of the deep freeze and everybody, they're giving him all his belongings back, and they bring out a Swedish-made penis pump. And it's incredible how, I think of all the things that we deal with for erectile dysfunction, this one probably carries the most. I mean, people are embarrassed about it, and it really is an incredible tool to help you regain size, length, girth, to help you achieve that erection that you're looking for, to be able to have an erection that's rigid and sustainable enough for the entire sexual intercourse. You'll see the recurrent themes. You know, it's not very expensive. It's a one-time fee. It's something that you can use for many different aspects. It works well. You can use it for rehab to rehabilitate your penis, or you can use it for on-demand. And I think really we've underutilized the vacuum erection device. And so when I was given the opportunity to give a talk about the vacuum erection device, I thought it was, I jumped all over it. I thought it's great because people talk about, oh, let's talk about Viagra, the sildenafils and tadalafils, the pills, or the shots, or the penile implant. That's the sexy stuff. Nobody thinks that this thing is very sexy, but guess what? This thing will provide something that somebody may believe is very sexy. And so I think it's a great thing. Again, I hope this is educational and entertaining. A little bit more about my background. I'm in private practice in Miami, Florida, born and raised down here, but I did my training, Boston University School of Medicine, where I trained under Ricardo Munares for sexual medicine. So right from the get-go, right when I was in medical school, I knew this is not just urology, but this subfield was what I wanted to be in. And I went to the University of South Florida in Tampa, and I did my residency and fellowship working under Rafael Carrion, another guru of the field. I currently am a partner at Urology Speacialty Care private practice. I do general urology with a subspecialty in sexual medicine, andrology, male fertility. I'm also the head of the sexual medicine, andrology, male fertility section of the Miami Cancer Institute, and I'm the chief of urology at Baptist Hospital, Maine. But of course, this is my passion, sexual medicine side. So I believe there is a question that Austin posed to the people who are They're here today just to have an idea of, there we go. So the quick polls, how long have you been experiencing erectile dysfunction? This is something we sent out to see what most of you guys answered, just so you guys know more or less what we're dealing with, how many of you guys are experiencing this. So the majority of you guys had more than 3 years. And yeah, it's a very common thing. You know, erectile dysfunction is something that we're all going to experience. We're doomed, unfortunately. That's the bad news. The good news is we got plenty of things to offer, and we'll make sure you have sex until the day you die. I think there's one more question. Let's see if, there we go. How have you attempted to use a VED or vacuum erection device before? All right, so 50-50. I think that's great. Hopefully, you know, I love to skew that number more to the 100% because, again, I think it's a wonderful treatment modality for any guy at any age. And my hope is that we, as urologists, especially us that specialized in this sort of process even more. So, of course, let's start off here again. Before we can go into the vacuum erection device, we first got to talk about what exactly is it that we're trying to do here. Realistic expectations and goals. You have to have an idea of what we're gunning for. What's our goal here? And the goal is an erection, right? The stars have to align and have to allow us to be able to get this erection, the penis to fill up with blood, to be rigid and sustainable enough for the entirety of sexual intercourse every time we want it. How does that happen? Well, first you need arousal. It may sound very simple and obvious to you guys, but you'd be surprised how many patients I see on a daily basis, actually, who doesn't realize, hey, it's not just take the pill, take that sildenafil or tadalafil and wait for something to happen. You need arousal. That arousal will cause the nerves of the penis to release nitric oxide, and this then starts this cascade of events, which ultimately, if you look at the screen, bug eyes, right? You get a smaller one and a bigger one. The smaller one is a flaccid state cross section of the penis. So take the penis cut in half. You see those little arteries, the red stuff right down the middle. Those are the arteries, the corporal arteries. That fills up with blood when you get aroused. That will then fill the corpora. You see those bug eyes open up. It fills up with blood, and the veins, which are the blue parts, will then sort of block off and prevent the blood from flowing outwards, and that allows you to have your erection. You have your intercourse, you have your orgasm, you ejaculate, and what happens? And all this begins to revert. The veins open up, allow all the blood to flow back, and you detumness. And that essentially is what we're gunning for here, what we're trying to achieve here. And so here's your vacuum erection device. You know, it comes in this nice little purse. You can fit everything in there. You have your multiple different components, which we will go over, so you are familiar with all of this. So what is this? It is an FDA-approved medical device. It's been around since the early 80s. Goes by many different names: VED, vacuum therapy system, penis pump, you name it. Essentially, it's a hollow tube that you stick your penis into. Boom. When your penis is inside, you have two different kinds. You have the mechanical, which essentially is this right here, or you have the electric one, which you press a button, and that will then create this negative pressure inside, which will passively have blood flow into the penis. And then depending on you having sex, if you're having sex, at that point, you can then use these rings, which you stick your penis right into the middle, you put all the way to the base, or if you're doing it for reconditioning or rehabilitation, you just cycle it. So you pump it up, you hold it for a few minutes, you press the deflate button, which would be this button right here, and that ultimately will then deflate the penis, and you can cycle that, do that again, fill it up, hold it for a few minutes, deflate it, fill it up, hold it for a few minutes, deflate it. It's very effective. It works in close to over 90% of men. So most guys that we use this will see an erection when they create this negative pressure. And really the difference between the two, one's the mechanical one, the other one is, so one's manual, the other one is battery powered. It's like going to buy a car. You know, they're both luxury cars. One's a Mercedes, the other one, let's say, is a Rolls Royce. So if the piece of the Rolls Royce breaks, okay, it might be a little more difficult to fix, but it's a Rolls Royce. So some guys would prefer the Rolls Royce, other guys are okay with the Mercedes. They both work great. Like, we get a lot of sexual medicine from the orthopedic literature, you can believe it. Yes, we are dealing with a bone, I guess. Some guys would say is the most important bone in a man's body. But ultimately, the orthopedic world, they talk about orthotics, orthopedic devices they have to fit the right way, and people have to get used to using these. And so there are a lot of components. When it comes to these vacuum devices, I tell guys, if you're going to get one, first of all, make sure that you're really going to use it. Because if this is just going to gather dust, don't get it. Realize that the first time you use it, you might get frustrated. Don't get frustrated. It takes some getting used to and adjustments, and you're not born knowing how to use a penis pump. It just doesn't happen that way. I obviously feel more comfortable. I've used these for many years with my patients. And so you may have to make certain changes and adjustments just like you would for glasses, knee and back braces, and crutches. And so just like the orthopedic side, we should take a page from their book and realize, hey, it's not a one size fits all. And these are the different components. You got your pump head right here. You got your penile tube right here. You twist this in here, and when you twist it, it fits in there. You got your transfer seal sleeves right here. There's one of them, the normal, the basic size and the smaller size. It's not a one size fits all. You got number 4 there. You can see is your lubrication, because let's face it, there's no such thing as as too much lube at least in urology. You got the constriction rings, which is number 7. And the sizing guide, and this is usually your rings. Penis in there, you use these to stretch it open. So you can decide there which ring size is ideal, and then you can use this ring loader to be able to load it up. Penis goes in on this side, and you sort of stretch this ring over on top of this until you get the ring onto the penis. And so these are the different components. So it's all about realistic expectations, as I told you before. And so again, the more you use it, the easier it'll be, the more natural it'll be. Like anything else in your body or anything else that you're trying to incorporate, practice makes perfect. First steps is make sure that the patient, that you guys are really willing to use this. Again, don't waste the money. If you don't waste the money, if you think this is going to be sitting in your bathroom somewhere under the sink, but if you are willing and you're motivated, and you want to use it, especially if you have a supportive partner, it's a wonderful tool, a wonderful weapon you can use. You want to try to use it. You can either use it to be able to have intercourse. You can use it together with other treatments, pills, gels, injections. If you want to use it for rehab, you can use it for rehab. The whole goal is you want to try to mimic the normal, organic, spontaneous erections that we have, mostly at night. Sometimes, unfortunately, we lose these, and so you want to try to mimic that, and you want to try to have these erections, the fullest erection you can inside the tube for a few minutes. Remember, use it or lose it is a real thing that definitely applies in this field. For the men that have gone a very long time without having erections, this is a wonderful way to try to get your penis to realize, hey, I'm supposed to be doing this. I'm supposed to fill up the blood. I'm supposed to allow good blood flow to corpora to provide nourishment and allow that penis to heal, to regain size, girth, length, and function. And so this is a wonderful tool that we use this. Next, we're going to go over a video now. It's a few minutes long, so bear with it, but I think it's wonderful for guys, especially, again, this is kind of a foreign object, and not many people are used to this thing. And so this video does a really nice job going over it. And when you buy these pumps, I do bring the DVDs, which I believe these videos are on there. So.
Before you start, familiarize yourself with the contents provided in your Rapport Classic Vacuum Therapy device system. You will find the Constriction Ring sizing guide at the back of your Instruction for Use booklet. To use your Rapport Classic device, you will first need to determine the correct constriction ring size. You have received 5 constriction rings with your Rapport Classic device. Select a slot which fits firmly around the base of your flaccid, non-erect penis. Try the largest size first. Each slot has a ring size marked above it, which corresponds to the ring you require. The constriction ring is placed at the base of your penis next to your body, and choosing the correct ring size is important to maintain the erection for the necessary period. Once you have selected the right ring size, you're ready to begin. There are 2 transfer sleeves provided with your Rapport Classic system. Depending on the size of your penis, you should choose which of the 2 is likely to be the most suitable. Remember, your erect penis will need to be withdrawn through the transfer sleeve. One of the transfer sleeves included with your Rapport Classic system is already attached to the penile tube. If this is the correct size transfer sleeve for you, you can leave it in place. If not, remove it and fit the remaining transfer sleeve. Fit the loading cone onto the transfer sleeve and apply a little lubricating jelly, included with your system, on top of the cone. Holding the constriction ring by the outer handles, simply stretch and pull the ring down the loading cone until it slips onto the transfer sleeve. Make sure the constriction ring is located on the flat groove at the center of the transfer sleeve. The constriction ring is now mounted and ready for use. Before continuing, make sure you use the lubricating jelly to lubricate the end of the transfer sleeve. Also, lightly lubricate the penis to prevent it from sticking to the inside of the penile tube during insertion, or while using the pump. The pump head has 2 small pegs on each side above the orange ring. These should be positioned into the 2 grooves on top of the penile tube. The 2 parts are then locked together with a twist, so that the 2 pegs slot down and locate at the lower end of the groove. If these 2 parts are locked together correctly, it will ensure the unit is sealed tight enough to create a vacuum inside the penile tube. To ensure a vacuum will be created, insert only your penis into the penile tube and apply slight pressure to the seal, with the transfer sleeve against your body at the base of the penis. To ensure that a vacuum is created, it may be necessary to groom the hair at the base of the penis. Make sure the constriction ring on the transfer sleeve is in the correct position, with the handles to the top and bottom. Continue pumping slowly to create the erection. If you feel any pain, stop pumping and press the release button to eliminate the vacuum. You can try again when you're ready. Pumping slowly is most beneficial. When the desired erection has been achieved, continue to hold the tube tightly against your body. Ease the constriction ring off the transfer sleeve and onto the base of your penis. Press the release button to lower the vacuum pressure and remove the penile tube. With the constriction ring in place, sexual intercourse can be accomplished. If a condom is to be worn, it should be put on as a last step. Please ensure that the lubricating jelly used with the system is compatible with your condom type. To remove the constriction ring after intercourse, simply grasp the outer handles to stretch the central ring. As the blood is released from the penis, it will decrease in size and the ring may be easily removed. Do not wear the constriction ring for more than 30 minutes at a time, and allow a minimum of 60 minutes between uses. Please consult your instruction booklet for a comprehensive set of instructions, safety precautions, warnings, troubleshooting, and cleaning instructions.
All right. So hopefully that was educational, provided some good information. So that's how you would use the pump for intercourse, especially if you're deciding to use these rings. Now, the other aspect, the other, say, major thing we're looking for here with these vacuums is how do we recondition or rehabilitate our penis? Again, the orthopedic literature. Somebody injures their knee, their elbow, their neck, their back, whatever, you'll do rehab. You'll do certain exercises. You'll use certain machines to try to rehabilitate yourself and regain some of what you've lost. Why wouldn't we do the same for erectile dysfunction? Essentially, your penis is injured. Why don't we try to rehabilitate our penis? And so, again, it's highly recommended men who have been sexually active and no longer having these normal erections that the penis forgets, oh, wait, I'm supposed to be doing this, whether it be from normal aging, medical issues such as diabetes, hypertension, or medical conditions that may be a little more abrupt, such as prostatectomies, bladder cancer surgeries, radiation, things like that. And so you want to try to mimic this sort of habitual activity that the normal body should be going. 3 to 5 natural erections during sleep. And so you want to try it at least a couple of times a week, 3 to 5 times a week for 20 to 30 minutes, try to use this pump. And really, the way I describe it, and the way I tell patients is the rules of 3. It's easy to remember. 3 times a week, each session, you're going to stick the penis in and pump your penis up holding it erect for 3 minutes, and you do that for 3 times. So 3 times a week, 3 cycles, 3 minutes each cycle. It makes it easy to remember. You can do it, again, you may need to do it more or less depending on your issues and depending on how well you're responding it. But the more you use it, the more likely you are to see some improvement. Keep that in mind. You can see it again here. So you want to stick the penis in there, create the artificial erection. After you make the seal, hold that erect for a good 3 minutes. You want to then release it by pressing the release valve. This is the release valve again, for those of you that did not see it in the video. You press this button, and then that will allow things to release. So essentially, let's just say your penis is in there. As I'm doing this, I'm creating a seal. It's actually sticking to my hand. So this will stick to my hand. I don't think I let go. It'll stick, but it's fine. Then you press the button and you'll hear the release. I don't know if you guys heard that, but that'll release it after holding it for a few minutes. Again, you can do it a few times. If you incorporate this into your protocol, your rehabilitation protocol, you're going to see a change. Most patients I see in the office, the guys that really use it, come back and say, wow, that stuff's great. So you got to get over the awkwardness. Absolutely. People, when I first began to say, what, a penis pump? You mean the thing I can buy in the adult stores? Yes, but it's not a medical grade penis pump. And if you get over that part and you really incorporate it into your daily routine or your weekly routine, you're going to see incredible. Your quality of life will improve from a sexual standpoint, without a question. So who's the best candidate? Really, anybody. This is a sort of a loaded question. All men can really incorporate this if they wanted to. So again, you can use it to having intercourse. You could use it for reconditioning and rehabilitation. You can use it in combination with the other therapies. Now, I always tell people, what are the major therapies for erections? Pills, gels, injections, implant. Well, there's the 5th one. There's the most versatile one that you can add to all of these. You can use it together with your tadalafils or your sildenafils. You can use it together with your injections, your trimix or bimix. You can use it with almost anything. And it's wonderful for the rehabilitation of men who have undergone cancer surgeries, cancer radiation, such as prostatectomies, cystectomies, things like that. And so remember, once you get over that awkwardness and you really incorporate it, you're probably going to be extremely happy. Side effects, it will cause some blocked ejaculations, unfortunately, especially when you put the ring on, because the ring will constrict the urethra. And when you constrict the urethra, when you have your orgasm, nothing will come out. It can cause some numbness, some bruising, and discomfort. It's recommended not to leave these rings on for more than 30 minutes. If you're feeling pressure or pain as you're pumping up, press the release valve, and that will allow the penis, the vacuum to release and the penis to detumesce. You want to be careful if you're using anticoagulants such as Coumadin, Brilinta, Plavix, aspirin, Lovenox. Not that you couldn't use it. I got plenty of patients that use it that have it, and they really are perfectly fine. But there's something you want to talk to your practitioner about if that is the case, because of the potential for hematomas. And again, any issues, you can go to the MenMD website. We also, on our website, urologistmiami.com, you'll be able to get on our YouTube channel. I have a lot of videos on there of different aspects of sexual medicine. Again, my passion. And as I tell most guys, remember, you're going to have sex until the day you die. That's not the question. I'll make sure of that. My job is to guide you. You're the captain, I'm the guide. I'm just here to give you the rules of engagement and the weapons. You're the ones going to war. And so thank you, Owen Mumford, for providing us with this little guy right here. Not a little guy. I guess you can't really use that term when we talk about sexual medicine. But this guy right here, I hope this was very educational and entertaining for everybody. We will now open it up to the Q&A session. So I'm going to stop sharing my screen. I'm going to let Austin take it from here.
All right, so we'll jump into the questions here. What is the difference between the VEDs that MenMD sells and those that I find on Amazon for half the price? Is one medical grade versus the other not? I think you touched on this a little bit just a minute ago.
Sure. Well, I mean, first and foremost, there are certain things that I think it is okay to buy refurbished. Penis pump is definitely not something you want to buy refurbished, because you never know whose penis was in there. And so unless you're buying it from a reliable source, you gotta be careful. The other aspect is this is a medical grade penis pump. The worry with some of these pumps is they don't have the pressure regulator, they don't have this ability to get rid of this vacuum if necessary. And so some guys who buy these at adult stores, they pump. Next thing you know, they show up to my office with a penis that looks like an eggplant. So you really want to be careful buying where you're getting it from and buying it from a reputable source. MenMD, as I said, I put my trust in them for 10 years now to take care of family and friends, really.
All right. Next question here. During practice sessions, the urge to keep pumping the handle is always present. Can I damage my penis if I over pump?
Yes, you can. The key word in the video was if you feel pain or pressure, well, not pressure. If you feel pain or discomfort, release the vacuum. If you get to that point, that's when you want to press that button right here. Let's see, I think it's kind of tough. I didn't realize it, but there's a button right here that you press, and that'll release it. So it should not be painful. If it's painful, you're doing it wrong.
All right, next question here. I don't seem to be getting a proper seal with the VED. I read that I should manscape, and that should help with getting a proper seal. How important is it to do that, to use the VED?
It's incredibly important. Something as simple as, quote unquote, manscaping, or just, releasing some of the actual, or shaving some of the hair that just around the area where this is going to pop into, so you want to sort of put this on, and that'll leave a little mark around the area where you're going to have to shave that portion of the hair, so that when you put this on there, you'll seal a little bit better. Not only that, if you get hair stuck in here, sometimes it'll get pulled in and it can be a little bit uncomfortable.
All right, got another question about pumping. How can I be sure I'm not pumping too long? I stop using my pump when a red area develops near the head.
Yeah, again, I've heard red areas. I've heard of calluses. I've heard of hematomas. If you come up with an algorithm, especially, again, the importance of following these guidelines, and that's why the rule of threes, it's so easy to remember. Most guys, after pumping to getting a close to 100% as rigid as you can, and holding it for 3 minutes like that, should not cause any issues. There is an exact amount of pumps that you are supposed to use, or the exact amount of seconds that you're supposed to press that button for the automatic ones. So you got to play it by ear. Again, it should not be painful. If it's painful, you're doing something wrong, you got to stop. You should not have it for more than 5 minutes in there erect. And if you follow those rules, the rules that we set out, you should be okay. You shouldn't be developing those red spots. You shouldn't be developing the petechiae or the hematomas or the calluses that some people can see.
All right, next question here. A little bit long, so stick with me. I have a vacuum pump. Although it achieved a sustainable erection suitable for sexual intercourse with my wife, she said it didn't feel fully erect. It was probably a 6 hardness. What can I do to achieve full firmness for sex? Should I combine VED use with an oral med or injections?
Yeah, that right there is the. Now, I see my patients every 4 to 6 weeks, and I see them every 4 to 6 weeks because of things like this, because it's not difficult to get somebody almost there. The most difficult part is when they're almost there to the being there. That extra couple 5-10% erection that they're looking for. And there's a couple aspects to this. Number one, realistic expectations. Again, I tell everybody, you'll have sex until the day you die, but I ain't getting you that penis yet when you're 18 years old. And so patient and partner need to understand that. Okay, the partner's also genitalia is not going to be the same as well. But many times this issue of not quite there yet can be achieved by doing multiple things and bringing multiple therapies together, such as, exactly as you alluded to, using some oral medications. I a lot of times will combine oral medications. I'll do a daily dose tadalafil, most of the times ordered from NMD, and I'll boost, and I'll tell patients you can take some extra sildenafil or tadalafil. You can incorporate also to that some of the vacuum devices. You can even incorporate daily dose tadalafil, boosted tadalafil, the vacuum device, and a little gel, a little intraurethral gel therapy, which is also ordered from NMD. Wonderful, wonderful product. Or you can also combine it with injections. But this is the key. This is where being and having somebody who's going to be able to guide you is ideal. You need to have somebody who feels comfortable and is well versed in all of these different treatment options, which to me was so important to talk about the vacuum device, because people talk about the other treatment devices all the time. Rarely does anybody want to talk about this. And this is a great way. Most of the times I got guys the other way around. They tell me, well, I'm not quite there with the pills. What can I do to, my wife tells me or my partner tells me it's not 100% rigid. I'm maybe 90% or 85%. What can I do to get to that 90%? Well, boom, you got it. You include these two and you're going to be able to get there. So I think you're heading in the right direction, but I would proceed with caution and do it with somebody who feels comfortable guiding.
Perfect. Next question here. After pumping the vacuum and getting erect, I place the ring at the base, but it doesn't keep my penis erect. What am I doing wrong?
It may be that the ring is not sized appropriately. You may want to go to a slightly smaller size. But again, that this is not going to work for 100% of people. So this combination helps, but it's not going to work for 100% of people. And there are people who are going to be refractory to this for intercourse. And so if that is the case, again, importance of following up with somebody who's well-versed and can sort of guide you and help you get to that next level to be able to not just achieve, but maintain an erection.
All right, next question here. I started using the vacuum pump about 1 year ago for therapy. I can now naturally have erections, but it's only for a few seconds. What does this mean? Am I regaining my erections?
Yes, that means you are rehabilitating yourself, and I applaud you for doing that. You will unfortunately reach a limit. I don't know how far you'll get. I encourage you to continue. Maybe you'll get a little further. Maybe you'll get to a point where you're going to achieve that erection that you were looking for before. But the short answer is you are rehabilitating. You're reconditioning yourself.
Okay, great. I've got a few questions that just came in regarding the use of injections with VED. What's the proper way to use an injection with the VED?
It doesn't matter the order as much. I've had some patients that feel more comfortable pumping their penis up a little bit so that they have some fullness. It makes it a little bit easier for them to find the areas of where they want to inject. Especially the heavier set gentlemen that I see. Some guys will do it completely flaccid, inject, and then pump. The problem with injecting when you're 100% rigid is that unfortunately you have a slightly higher risk of bleeding there because of the increased blood flow. And so you want to be careful there. If you're going to do that and inject, you want to then hold some pressure along the side of the penis where you injected. But you can play around with it. Again, as the guide and not the captain, my job is to give you the different rules. And you can really play around with this depending on your body habitus, depending on your penile size, length, girth, how comfortable you feel with it. If you want to just get yourself a little bit erect, enough to be able to see the sides of where you need to stick that needle, take the needle and then pump yourself up even more, that might be the better way of doing it. If you want to inject first and then pump yourself up, that's probably the safest way of doing it. If you want to do it, then be completely erect and then inject yourself, just be careful because you might have a slightly higher risk of hematoma. Excuse me.
All right, next question here. Can I achieve permanent results with a VED if I'm looking for size enhancement?
Sure, yeah. And, it's probably the safest way of enhancing penile length and girth. It's as we get older, unfortunately, the joke is the prostate gets bigger and the penis gets smaller. And so it's something you probably want to incorporate and continue to use. But yes, I've had plenty of guys that said, hey, I've regained a good amount of length and girth and size by using this vacuum. Now, after you've regained it, again, it's use it or lose it. And if you now are no longer having these spontaneous or daily, multiple times a week erections, you're going to start to lose some length and girth and size because you lose that elasticity again.
All right, we got a couple questions as well that came through regarding the rehabilitation process. Someone says the video said 1 to 3 minutes for the erection, holding the erection, and then 10 to 15 minutes. Can you clarify that? Another person also asked how long between the 3-minute erections for the rehabilitation process.
Yeah, so I like to use the rules of 3 because it's easy to remember. 3 days a week, 3 cycles, 3 minutes erect for each cycle. How long to wait in between, that doesn't really matter as much. Usually guys, they'll cycle, get their erection, hold it for 3 minutes, let it deflate completely. You want to let it go to as flaccid as possible. Maybe wait just a few seconds and pump yourself up again. You could wait a few minutes as well. The time in between is not as important. I think just doing the actual, the fill, deflate, cycling is the most important part. Now, I wouldn't leave it in there for more than 15 minutes just because of the potential injury that you could have there. So you probably want to cycle anywhere from 3 to 5 minutes, meaning pump it up, hold it inflated for 3 to 5 minutes, and then let it deflate.
All right, next question here. If prostate was removed, will this device work?
Yes, it could. Absolutely. Yeah, this can be used if the prostate was removed with nerve sparing. This may even work as well for if the bladder and prostate were removed, which is another common thing that people don't tend to talk about a lot, is a cystoprostatectomy for bladder cancer. So yes, it can be used. It can also be used, and it can be used successfully also in people who've had radiation to the prostate.
All right, got an interesting question here. Can a penis be too small to get into the pump?
No, you can use. Again, they have the adapters, and so you'll get a smaller fit. The penis itself should still be able to work. It's all about creating a good seal. And so size of the penis is not as important because this is not so much my penis is too small to fit in here because it's too big. No, this is just the smaller fit will help create an easier seal on smaller penises.
All right. Do VEDs assist with Peyronie's disease treatment?
That's a wonderful question. I'm glad somebody brought that up. We tend to concentrate more on erectile dysfunction, but Peyronie's, or for those of you who are not familiar, this is a curvature of the penis. It's a scarring of the tunica albuginea, which is the surrounding structure of the corpora cavernosum. So remember the bug eyes that showed when we did the cross section of the penis. Those bug eyes, that surrounding structure of each corpora is the tunica albuginea. When somebody develops a scar there, it creates a curvature. And I incorporate my vacuum devices actually in all of my Peyronie's patients. I tell everybody they should use it to try to improve, in order to stretch the penis. Men tend to lose length and girth and have erectile dysfunction with Peyronie's disease, so it'll help strain it. It'll help improve the girth from especially the area where you tend to have this sort of divot. And it'll also help with your function, which you tend to start to lose as well when somebody has Peyronie's disease.
All right, I got another question about using the VED to regain size. They had prostate surgery back in 2019. Will using a VED get them back to their original size pre-surgery? I guess maybe another follow-up question is, what's reasonable to expect in regards of regaining length?
Yeah, I don't think there really isn't any major study to tell you if you use this, you're going to regain 1 to 3 centimeters worth of length. It's just impossible to know that. And it's impossible to know, are you going to be the way you were before surgery? Probably not. I mean, as we get older, your penis is going to change, regardless of whether or not you have surgery or whether or not you have radiation. Will you gain some length and girth? Yeah. How much? Impossible to tell. If anybody guarantees you something, they're just making it up, and it's not really accurate. So.
All right. Next question here. Is it possible for the tension band to cause pain with ejaculation?
Yes, it can. Unfortunately, the downside of the bands, is the blunted or the inability to be able to ejaculate because it constrains. It sort of wraps around the urethra. And it prevents that from coming out. So some guys may have some discomfort. Usually discomfort is not as much of an issue. They may not like the fact that they don't ejaculate, but it absolutely can happen. I've seen it happen. Usually not to the point where they have to stop using it, but it's noticeable.
All right, next question here. I've been using injections for sex and they don't seem to be working anymore. Would you recommend this device? How is it different from injections?
Yeah, absolutely. You could try using this device. I think you got to use everything. Again, the importance of following up with somebody who's well versed in all these treatments. Some guys, unfortunately, the erections have gotten to a point where the injections aren't working as well. You can always go up on the concentration of the injections, on the dosage of the injections. You can combine this with the injections as well. Doing it by itself, is it worth a try? Sure. Again, I don't know the particular case and whether or not this is it's a lower concentration, lower dose. Maybe guys who have very high concentration injections, probably the pump alone is not going to be enough. You can try doing combination therapy. You might have some better results with that.
All right, next question here. Are there additional risk factors in using a VED if you have a varicose vein in the shaft?
So yeah, there are veins. It wouldn't be called a varicose vein. There's a specific type of disease called Mondor's disease, where it's essentially a thrombophlebitis or inflammation of the vein of the penis. And yes, it could potentially exacerbate this. So again, importance of trying it out, seeing how things go, and if you're realizing, oh, you know what, this is causing pain, it's causing engorgement or injury to the vein. Most guys have veins on their penises. It's a normal anatomical thing that we as men have. Most guys do not have any issues, even those that have the more engorged veins. But it is a potential risk and a potential side effect that you may experience.
All right, I had prostate surgery 2 years ago, and now there's no function. I've been using a VED to try to keep length in preparation for an implant. Is that the right track?
Absolutely. I use it all the time for my guys. Now realize that the implant itself is essentially placed and sized intraoperatively, meaning whoever you're having the surgery with, they're going to put the biggest, baddest implant that can fit in there. At least they should. It may not be the exact same size of what you're going to see when some guys will use this, stick their penis and pump it up, and they'll put little marks in the actual tube to see if whether or not that's the length that they're going to gain with their implant, because the implant fills up the tunica virginia, those bug eyes that I showed you. And it's the tunica virginia of the corpus cavernosum. The tunica virginia is the second toughest membrane in your body. That's what holds it in place. That's what prevents the implant from coming out. And so it may not be the exact same size, but if you're trying to regain as much length and girth as you can so that you can get the biggest, baddest implant, absolutely. This is a wonderful, wonderful way of trying to do that.
Next question here. I get numbness from my VED. How do I prevent this?
Yeah, unfortunately, that is one of the side effects. You can have some numbness, and maybe you're pumping it too much. Maybe you're using it too much. There is such a thing as using this too much. I've had some patients that I've had to tell them to tone it down a little bit. You got to play it by ear. This is happening. I suspect you're probably using it a little bit too much or being a little bit too aggressive with it. So you might want to tone it down just a little bit.
All right, next question here about nocturnal erections. Why are nocturnal erections the determining factor for ED? If I have nocturnal erections, do I need a VED device or ED meds at all?
Yeah, no, I don't incorporate that at all in my algorithm of whether or not somebody needs to get treatment or somebody has ED. By definition, is somebody erectile dysfunction is somebody who has any trouble with getting or maintaining erection for the entirety of sexual intercourse every time they want it. And so regardless, somebody can have psychogenic erectile dysfunction, meaning they have great nocturnal erections and there's a high psychogenic component when they want to have intercourse. Treatments are still the same. I still recommend pills, gels, injections, pumps. All these things can be used because the reality is you can have nocturnal erections, which is great. That's wonderful. That tells you have good penile health, but you can still have ED because the whole purpose is you want to have these erections when you want to have them. And actually, psychogenic erectile dysfunction is a real organic issue. When somebody has psychogenic erectile dysfunction, your body, that means your body's getting anxious. It's producing two hormones, epinephrine and cortisol. These are fight or flight hormones. These are hormones that prevent you from having intercourse because evolutionarily, we were not meant to have sex during times of stress. Okay, if somebody puts a gun to your head and what happens? Your body then all of a sudden gets into fight or flight mode. You produce epinephrine and cortisol, and that allows you to survive in that stressful situation, right? When we were having sex in our caves, back when we were cavemen, and a big animal came in to eat you, what would happen? You run, right? I guarantee you nobody here can run a sprint with a rock hard erection and maintain that erection by the end of the sprint. Why? Epinephrine and cortisol. Those are the hormones that you produce that are psychogenic erectile dysfunction. So it's a real organic thing, regardless of whether or not you have nocturnal erections or not. I really don't incorporate that. It's good to know because those patients tend to respond a little bit better. Maybe some of these guys need sex therapy, but even with medications and with the pump, you should still be able to achieve that erection that they're looking for, regardless of whether or not they're having nocturnal erections.
All right. Next question here. At what point is it recommended to skip over a VED and go directly to injections or other treatment options?
I think, and this is a very personal question for the practitioners. I'm very methodical. I like going step by step. That's why I tell people on the guide, there's an algorithm that's created and that I use, which is pills, gels, injections, implant. I incorporate the vacuum release. I talk about it right from the beginning because it is probably the most versatile and you can combine it with anything. The guy's willing to use it. It helps with the rehab and with the on-demand use. And so skipping, I mean, again, it depends on the situation. It depends on the patient, the practitioner, the goals. It depends on the history. So are there certain situations where you might want to skip a VED? Potentially. Is it a common thing that in my practice? No. Usually unless somebody comes in and has really tried every single thing out there and hasn't worked, and let's say they want an implant because they've tried everything, they've shown that they've tried everything, that's really a rare situation. I do like going through these steps. I think it's important. It provides patients and provides me with the peace of mind knowing that everything's been done in an orderly fashion, and we're doing things from a less invasive to a more invasive stepwise fashion.
All right, next question here. My doctor put a penile implant in 10 years ago. It's now not working properly. Can I use a VED?
Probably not. I think you're gonna have to come visit me in the office and we can swap you out and give you a new implant. Highly unlikely. The implant's not working. Unfortunately, I don't think a VED is gonna work for you either. Unfortunately, that's one of those tough situations. You gotta turn in the old and trade up for the newer.
All right, got a question here from someone about organ transplants. Are VEDs an effective treatment option for people with organ transplants? Is there anything they need to be aware of?
Depends on the organ. If it's a penile transplant, you may want to be careful. If it's a kidney, shouldn't matter. Liver, shouldn't matter. Lungs, heart, shouldn't matter.
All right. Got another question here. After prostate surgery, my urine comes out in different directions, like a shower. Why?
That's a loaded question. It's kind of difficult. You'd have to evaluate the urethra. You'd have to evaluate the mechanics of the bladder function with the urethral function, urodynamic studies. There's a couple things you'd have to check to see why your urine stream is shooting out that way. So.
All right, got another question about the combo therapy, in particular using sildenafil with a VED. Do I need to adjust the dosing at all with this, or do I keep the same dosing with my sildenafil to use it with a VED?
You can use the same dosing. You could probably cut back if you wanted to, but you can use the same dosing.
So I have type 2 diabetes. Does this impact erectile function? If so, can I still use a VED?
It absolutely. The number one assassin of erections, I say, is diabetes. And so you want to make sure your hemoglobin A1C is controlled, the blood sugar is controlled, because it's only going to get worse. You develop ED earlier and at a higher rate if you have diabetes, especially if it's not controlled. So can you use the VED? Absolutely. As a matter of fact, I would highly recommend it to try to prevent and improve some of this. Ultimately, diabetes causes corporal fibrosis, and so this should help you. Now, it's not a cure for the diabetes and the ED. You still got to control that diabetes in order to prevent not only erectile dysfunction, but worse things such as death, heart attacks, loss of vision, et cetera, et cetera. But yes, you can use it as well in somebody who's a diabetic.
All right, got another penile rehab question here. How many days a week should they be doing penile rehabilitation?
Again, you can do it as often as you'd like. My recommendation and the way that I teach it is at least 3 times a week. Rules of 3. 3 times a week, 3 cycles, 3 minutes each cycle. So maintaining the erection for 3 minutes, and that should give you some pretty good results. It's easy to remember.
All right, we got maybe one, maybe two more questions. Looks like we're running out of questions here. So we'll ask this one. I'll comb through the rest and see if we've got any others that we want to ask. But if not, we'll wrap up the event. So one of the last questions here is regarding the types of devices, battery versus manual. Is there a benefit to one over the other?
No, again, I think it's a very personal question. Like I said, both great devices compared, like I said, to luxury cars. Whether you want to buy the Mercedes or the Rolls Royce, it's up to you. The Rolls Royce breaks. It might be a little more difficult to get some parts, but hey, it's a Rolls Royce. Some people are okay with just the Mercedes. It's a very nice luxury car, and it tends to be a little bit easier. Now, with that said, let's say you're somebody who doesn't have good dexterity of your hands and you can't do this, and you may want to invest in the battery operated one because it might be a little bit easier for you to use.
All right, last question here. I had prostate robotic surgery about 10 months ago, and I've been using the VED for the past 6 months. I've noticed that I've developed a few red spots in the tip of the penis. Why? Is this a problem that can cause long-term damage at all?
Yeah, unlikely long-term damage. It could be a combination of things. Again, you might be a little bit too aggressive. Sometimes when you put the penis in, sometimes you're rubbing up against the actual top or side or bottom. And so you want to make sure you have a good fit when you're putting the penis into the actual pump. If you're noticing the penis is rubbing and it's causing some pain, a little burning, you might want to release and reposition the penis in the pump. It may just be you're using it too much. It may just be that you're using it for too long. It may just be a little bit too aggressive. So you might want to just tone it down a little bit.
All right. With that, I think that's all the questions. So with that, I'd like to thank Dr. Martinez for taking the time to present today. And we'd also like to thank everyone listening in for attending this MinMD Real Talk webinar. We hope it was informative and you'll join us again in the future. If you'd like to learn more about VEDs, you have a few options here. There are more resources in the Resource Center on minmd.com. Visit this page to view instructional videos, guides, expert articles, and much, much more. You can also call MinMD at 857-233-5837 or log into the password-protected secure MinMD portal to schedule an appointment with a MinMD clinical case manager. If you're interested in purchasing a VED from us, you can do so on the shop page in the MinMD portal or by calling into our office at 857-233-5837. Also, if you're just curious about the pricing, you can see that there as well, either by calling in or going to the shop. I'd like to thank everyone again for attending today's webinar, and we'll see you at the next one.
Thank you, guys.